Rejuran is a catchphrase in today's aesthetic medicine. In this video, we're going to dive into the science behind the main ingredient of Rejuran, which is known as PN or polynucleotide. So what is PN and how does it work? PN stands for polynucleotide, essentially a chain of nucleotides, the building blocks of our DNA. These DNA fragments are generally derived from salmon, the Korean salmon, or known as cham salmon or salmon trout. Mechanistically, PN seems to act in two major ways. First, it activates cell receptors, notably the A2A receptor, that triggers a cascade of healing signals, boosting blood flow, new blood vessel formation, and collagen production. Secondly, it provides raw material for cells to repair and build new DNA, aiding tissue regeneration through a salvage pathway. The net effect: PN therapy stimulates tissue repair, modulates inflammation, and enhances collagen production. Essentially, it gives your skin cells a boost to heal and renew themselves. PN treatments have been studied for skin rejuvenation, improving texture of the skin, elasticity, fine lines, etc., as well as scar healing and other uses. So what does the evidence show so far? Results are mixed but promising. Some clinical studies report significant improvement in skin elasticity, hydration, wrinkle depth after PN therapy. For example, one trial in patients with acne scars found better scar improvement and higher patient satisfaction with PN injections compared to placebo. There is also emerging research using PN for under-eye rejuvenation, especially dark circles and fine lines and wrinkles, and combination therapies. One study showed that adding PN to microneedling or radiofrequency microneedling led to greater wrinkle reduction and skin elasticity gains than procedures alone. However, not all studies paint PN as miracle. Several reports show only modest to no added benefit from using PN in certain settings. For example, in one split-phase trial for crow's feet wrinkle treatment, PN injections improved wrinkles about as well as a conventional skin treatment with no significant difference between sides. Moreover, the scientific community acknowledges that large, high-quality trials are still lacking. Much of the published support for PN comes from small studies or case reports. So while the trend is encouraging, we must remember that PN's effectiveness can vary. It's not a one-size-fits-all fountain of youth. And further research is needed to pin down how far its benefit truly go. So how this polynucleotide is actually used in treatment? Primarily, it is delivered by hand injection into the dermis of the skin, which is the deeper part of the skin. And it's rich in collagen and elastin and all that. Doctors use very fine needles to deposit a very small amounts of polynucleotide gel across the treatment area. The microinjection technique resembles mesotherapy. There's another method where PN is applied topically with microneedling, letting the microchannels created by the needles deliver the products inside of the skin deeper. Whichever the technique, treatments are usually done as a series or sessions, commonly 2 to 4 sessions spaced few weeks apart, to gradually build up skin improvements. From an anatomical perspective, the goal is to get the PN into the optimal layer of the skin where it stimulates collagen-making cells known as fibroblasts. For example, microinjections place PN in the deep dermis, the sweet spot for collagen stimulation. Following treatment, there is some immediate hydration and plumping, but that's mainly from the liquid. But the real magic is slower, and it takes weeks to months to show after successive treatment sessions. Is PN safe? Overall, the evidence so far suggests a favorable safety profile. Since PN is a purified DNA fragment and no proteins, it has low immunogenicity, meaning allergic reactions are rare. Clinical studies have consistently reported that PN injections are well tolerated with minimal side effects. The most common reactions are mild and temporary. Expect possible redness, slight swelling, or small bumps at the injection sites, and occasionally mild bruising. These side effects typically resolve within days. Importantly, no serious adverse events have been noted in published trials and cases so far. For instance, a controlled study of PN for surgical scar prevention found no significant side effects apart from mild local reaction. Another plus point is that PN does not physically bulk up tissue, unlike some fillers. So the risk of issues like vascular occlusion is extremely low. In fact, PN is sometimes dubbed as a regenerative filler, not because it fills space, but because it fills your skin with healing potential. Of course, standard precautions apply. Treatments should be done by a qualified professional in a sterile condition to avoid infection or injection error. And as with any aesthetic procedure, proper patient selection is key. For example, those with active skin infections or certain conditions might need to postpone treatment. But in healthy candidates, PN safety record is strong, making it an attractive option for those seeking rejuvenation with minimal risk. Now let's break down the advantages and disadvantages of PN therapy in skincare. So what are the pros? Natural biostimulation. Rather than artificially altering the face's contour, PN works by stimulating your own cells to repair and rejuvenate. It boosts collagen, elastin, and overall skin quality from within. This often leads to smoother texture, improved elasticity, and glow rather than dramatically filled look. Broad applications. PN treatments have shown versatility, from softening the fine wrinkles, fine lines, and tightening the skin to improving acne scars and even assisting with wound healing. It's essentially promoting regenerative healing wherever it is applied, which is a novel approach in aesthetics. Minimal downtime. Aside from some pinprick marks or mild swelling, for a day or two, there is typically little downtime, especially with newer delivery techniques such as microneedling. Safety profile. PN is considered generally very safe, and adverse events are very rare. There is no permanent implant or irreversible change. If you like the results, you can maintain them with occasional top-ups, generally every 6 to 12 months, and if not, the material metabolizes naturally over time. PN can be combined with other treatment modalities. PN plays well with others. Doctors sometimes combine PN injection treatments with treatments like laser therapy, microneedling, radiofrequency microneedling, or PRP to amplify results. It can complement these procedures by further boosting collagen and healing. This multimodal approach can yield better outcomes than either ones alone. Now the cons. Gradual results. PN is not an overnight miracle. It kickstarts biological processes that take weeks to months to show any visible improvements. Most protocols involve multiple sessions, and results build up gradually. If someone expects instant wrinkle reduction, they will need a reality check. PN's glow-up is subtle and time-dependent. Variable effectiveness. So while many see improvement, not everyone responds the same way. Some studies show only mild changes or no significant improvement compared to baseline. Factors like age, skin condition, and individual biology influence outcomes. Ongoing maintenance. The regenerative effects of polynucleotide, though long-lasting, are not permanent. Skin continues to age, and to sustain benefit, one might need maintenance sessions, perhaps every 6 to 12 months following the initial series of treatments. Procedure discomfort. So let's be honest, needles are involved. Even though they are tiny, multiple injections can be quite uncomfortable. Topical numbing cream helps, but those sensitive to needles might find it very unpleasant. Cost consideration. A PN treatment series can be relatively more expensive than one might think. It's a specialized product and often not yet mass marketed worldwide and requires medical administration. When calculating the cost, remember it usually involves several treatments. In conclusion, polynucleotides such as Rejuran represent an exciting frontier in aesthetic medicine, one that shifts the focus from simply filling and tightening. The science behind PN is fascinating, leveraging fragments of DNA to coax our cell into healing mode, thereby improving skin quality in a holistic way. Current evidence, including clinical trials and imaging histology studies, support several PN claims. We see increases in collagen and elasticity and tangible improvements in wrinkles and scar in many patients. The safety profile is robust, and the idea of a natural revitalizer is appealing to both patients and practitioners. That said, objectivity is key. PN is not a magic potion for everyone. Some results have been modest, and the research is still evolving. We need larger studies to fully establish who is going to benefit from the treatment protocols and how long the results are truly going to last. As of now, PN is a valuable addition to the aesthetic toolbox, especially for improving skin texture and quality. But it works best when combined with realistic expectations and a comprehensive skincare plan. The bottom line, PN treatment offers a novel regenerative approach to skin rejuvenation. It is scientifically grounded and generally safe, giving a subtle boost to your skin's own abilities to repair and renew.